heart failure, also called CHF, which is congestive heart failure. That's what it stands for. Basically, heart failure is fluid volume excess. You just have a lot of fluid in you. So, FVE for fluid volume excess. Okay, so do you know what heart failure? Also, by the way, you're not in the view of the camera. Some people get freaked out. No, you're good. No, you're good. You can want, but you can sit up here. You can teach it. What is basically heart failure? Like, what is happening, just in general? What's the heart experiencing?
Well, it's like it's not working.
Yeah, it just has like an increased workload, right? So it needs increased effort. So there's two different kinds. Do you know what they are?
Right and left.
Yeah, left and right. Perfect. Okay. Left and right. So you have to basically know the signs and symptoms and then nursing interventions for both. So the way I kind of differentiate between the two, when it's left-sided heart failure, it more has to do with the lungs, because the congestion is mainly in the lungs, because it backs up in the lungs, just the way the heart flow works. So I remember that with lungs starts with an L, left starts with an L. And then right is a more congestion of the body, so I just relate that to the body.
That's like edema and that kind of stuff.
Yeah, so we'll start with the left. What are some signs and symptoms of heart failure in the left? So you'd have edema in the lungs, right? And that's just because you have fluid in the lungs. Edema in lungs. What kinds of things would you like? If you were to listen to the lungs with fluid in them, what would you hear?
You're like crackles.
Crackles, perfect, yeah. And it's just because of congestion, the fluid's getting backed up in there.
Does that lead also to like pneumonia?
Yeah, they're an increased risk for pneumonia because it can get infected. Exactly. They're going to have a cough with lots of sputum, increased sputum, just because there's lots of fluid in there. And the sputum has a little blood in it, so blood in it. But it's not like 100%. They're not like coughing up blood, but it could look a little pinkish, little specks of blood, things like that. Also, so for them, they're going to have shortness of breath just because it's hard to breathe when there's all that fluid in your lungs. So another like intervention or just like something you'd see in a left-sided heart failure patient is you want them to sleep with their head elevated. Okay. Just because it's easier for them. Because in like the Maslow's hierarchy, oxygen comes before comfort. Because it's not the best to sleep with your head elevated, but they need the oxygen supply. So, and then they're also going to have decreased urine output. And this is like, you wouldn't really think that because if they have fluid volume excess, but since it's getting congested in the lungs, it's not really circulating through the kidneys and excreted. So you're going to have decreased urine output. Okay. So then we move on to right-sided heart failure. What do you think they're going to have?
What's the edema already?
Yep. So it's going to be peripheral edema, though. It's going to start in like their feet and ankles, like their wrists and stuff. Peripheral edema. Okay. What else do you think they'd have? What would their blood pressure look like?
Higher?
Yeah, because there's tons of fluid, right? Just have a lot of fluid up there. What do you remember what it's called when they have like their
JVD.
JVD, right? Jugular vein distension. And that's just because they have lots of fluid, so you can kind of see it pulsating. Like when you assess JVD normally, you put them at a 30-degree angle. But sometimes these patients, it's so bad, you can actually see it when they're like supine, which is kind of abnormal. So they also are going to have, increased nocturia. So that's just like urinating at night. And this is because they have lots of fluid going through their body, they're going to have more perfuse to the kidneys and excrete more. They're still going to retain a lot of it, but does that make sense how it's different between this one?
So, yeah.
Because this one's more congested in the lungs, so it's not going to get filtered as much. And this one's going throughout like the extremities, so it is going to be filtered more. So they're going to kind of wake up at night to have to urinate. Okay. And then there's 4 symptoms that are in both right and left. So I'm just going to do a line right here. It's in both. You have, do you know what palpitations are?
Shoot, I know what it is.
It's like when your heart's beating out of your chest. Like I know sometimes I'll just book it up the stairs and I'll stop and I like die and just like hear my heart and like feel it. Okay. They're also going to have weakness. And they have that because their heart is working super hard, so any energy they have, they kind of need to like focus it to their heart, pumping out that blood. So they're going to be kind of weak. With that, they're also going to have fatigue for the same reason. And they're also going to have an irregular heart rate and beat. Irregular heart rate / rhythm. Okay. And then one last one. I guess I said 4, but it's 5. Weight gain. Why do you think they have weight gain?
Just keeping excess of fluids.
Yeah, they're just retaining lots of fluids. Perfect. Okay, so we'll just make a baby chart over here. So, nursing interventions. What are some things that we can do?
Can you like diuretics?
Diuretics, yeah, they're huge. And what do diuretics do?
Increase urine output.
Yeah, so they're going to pull fluid off your body. So an example of one is just Lasix. It's a loop diuretic. So yeah, diuretic's huge medication. Another medication that we'll go into in number 9 is called digoxin. It slows and strengthens the heart, but we'll look at that later on. You also want to assess their weight daily. Also their INO daily. Just to see, like INO as an output and input, just to see like if they're progressing at all, if it's getting worse, or like if they like drink like 800 milliliters and they only put out like 200, you kind of have to be worried just to know like if it's worsening or not. You also want to decrease their sodium in their diet. Do you have any idea why? This is mainly just because like the number 1 rule, water follows sodium. So if you have a lot of sodium in your body and you're like orally intaking sodium, a lot of water retention because it's going to be attracted to the sodium. So you want to decrease it in their diet. For like the edema, peripheral edema, you can elevate the legs. Crackles in the lungs, fluid in the lungs. Yeah, reposition. You could incentive barometer, right? Also, teach them how to turn, cough, and deep breathe. Just kind of move those secretions and get them out. Okay. Do those all make sense? Okay, perfect.
What's the 1.5?
Oh, sorry, that's a incentive barometer.
Oh, okay.
IS. Yeah, that looks like a 5. It's hard to write down, though.